Welcome everybody. My name is Dr. John with Orlando Alternative Health, licensed acupuncture physician. And I wanted to shoot this video today just based on some conversations that I've had with patients recently and just some other information that I've come across. So health, for one thing, can be very confusing. There are many different supplements available, many different pieces of information that we hear, whether on the internet or different advertisements or through friends, and based on their experiences of things that have worked well for them. So the main thing that I kind of wanted to get at here today is I'll call it bandage approaches. So where I came from this idea is one of my patients reached out to me that one of his friends recommended a supplement that this friend said was working really well for him. So my patient sent it to me, asked me if I had any thoughts on that or any experiences with it. And I was honest, I said I really didn't. And you know, it may provide some value, but the reason that I want to speak on this specifically is the way that we address things in TCM, traditional Chinese medicine, is not the bandage approach. So the supplement that this patient reached out to me about was allegedly a testosterone booster, which this is kind of a sensitive subject for men generally. Men very often do not want to speak of this. So I was very honored that this patient was comfortable enough to reach out and discuss this. Men generally, once they get to about mid-30s, their testosterone levels generally start to decline, and that can result in various presentations. One of the primary ones is fatigue. There, of course, are many other things which I will not get into here because that is not the point. But you have to be very careful. Something like a hormone like testosterone, taking this bandage approach and just arbitrarily throwing something that may work at it and boosting levels without knowing that you necessarily need to take that approach can actually be very counterproductive. So let me step back and talk about how we would deal with this from a traditional Chinese medicine standpoint. So the way we look at things is in TCM, we look at the body as a holistic unit. What does that mean? That means we will go through in an intake and look at things like your digestion, your sleep, your stress levels, your bowels, as strange as that may be a conversation to have. For women, we look at female health, your menses, which is a very important gateway into things that are happening internally, and some other things. So we look at this whole picture of how the body is functioning as a unit. And we don't just haphazardly throw one or two herbs at it and hope that it boosts something. Because the way we look at things, this boosting is what we call tonification. So if you have an underlying excess pattern, as we call it, if you provide additional tonification, so in this case, we'd be just throwing a supplement at it that helps to boost testosterone. You throw this in there and you're just further exacerbating, so making the problem worse than what you started off with. And we don't want to do that. One of the prime examples that I see of this is I worked at a holistic wellness center. It was the first position that I had in this field after I graduated with my master's. So in that office, I would very regularly have patients come in with like a Publix grocery bag full of supplements. No joke, like they would show me 30 different things. I got this, I got that, I take this for that. Somebody recommended I take this. I saw this at 2 a.m. on online while I was having difficulty sleeping. That is not really an ideal approach either. There becomes a point where you're over supplementing and you're not utilizing any sort of strategy other than just, oh, well, I heard resveratrol is great for this, or I heard that I need B12, I got to get the B12, or I heard that magnesium, yeah, I'm going to do some of Dr. Swart's magnesium oil. If for those that don't know, he produces an amazing magnesium oil, and and so on. So again, the amazing thing that what we are able to do is we are able to not just say, okay, you have a headache, so we're going to prescribe you with Tylenol. First of all, I do not prescribe medications, over-the-counter medications. We prescribe herbs, but I'm using Tylenol as an example because it's something that most likely you're very familiar with. So instead of doing that, we will differentiate your pattern based on how you as a patient are demonstrating in front of us. So there may be 4, 5, 6, 7, 8 different paths that we could take to really get the ideal treatment to get you overall on the right path. But the most important thing is really identifying where your body's at as opposed to just throwing something at it. I don't want to make this video too long, but 2 other things that I'm seeing quite a bit of right now clinically are sleep issues. At least in the United States, I estimate based on the patients that I see clinically that at least 50% of the population is not sleeping well. And by well, I mean getting roughly 7 to 8 hours of undisturbed, restful sleep. And I think it's probably a lot higher than that. That's probably an underestimation. And one reason I think we could say it's significantly higher than that is we've got a Dunkin' Donuts, a Starbucks, or some other sort of coffee shop, like literally on every corner. And why are people doing that? Yeah, people like coffee, but a lot of people use it as a crutch just to get through their day-to-day operations and take that caffeine and push through it. Well, that too has repercussions as eventually you are, so to speak, burning the candle at both ends. And at some point, your body's going to make you hit pause and you're going to have to recover. And after 5, 10 years of doing that, your recovery for your body is not going to be an easy process. So, my point here today is instead of taking a haphazard approach and saying, oh, well, I want to lose weight, maybe I'll do this, or my energy's low, so I'll do this. If you are truly dedicated to your health and fixing that problem, why not take a thorough holistic approach that will look at your entire body, presentation, your constitution, and where you are at? I hope you found this video helpful and hope you are doing well. Feel free to drop some comments. You can always follow me on YouTube at Orlando Alternative Health. Also the same on Instagram. And thank you for watching today.